So before proceeding, we have a very prominent speaker, Dr. Srinivas Chakravarti. So he will take care the today webinar. So welcome, sir.
Thank you, Manish. So, shall I start the procedure?
Yeah. So you may introduce yourself, then we'll take your introduction.
Sure. Good afternoon, everyone. I hope we are on the global platform of the virtual meeting of this webinar on ISO 2658-2023. At the outset, I would like to thank Dr. Rana, who is the CEO of the QIA, as well as that of Manish for hosting us this webinar on this beautiful ISO 2658-2023. Myself, Dr. Srinivas, is working as a group director for the laboratory medicine for Kave Hospitals Group, which has got about 12 units spread across two states, Tamil Nadu and Karnataka. I'm having about 33 years of experience in the laboratory medicine, including histopathology, molecular biology, and microbiology. Now, let me just go ahead with that of what we have for the ISO 2658 itself. So just give me a moment to share my screen. Okay, hope my screen is visible to all and I'm audible.
Yes.
Okay. Now, the first question is we have to ask to ourselves that what is this ISO 2658 and why we are talking about today this? To understand this, let us go on to the first most important thing is this. What's the role of the laboratories in the healthcare practice itself? So today we know that about 80 to 85% of the clinical decisions are based upon the information which are derived from the laboratory test results, which we call it as an evidence for any of the diseases or prognostication or therapeutics itself. If the sample, what I have received at the laboratory has got a poor quality, the test accuracy is also affected. Now, once the test result has been affected, you know very well that it is going to cost much upon the clinical outcomes as well as that of the institution's reputability itself. So the pre-analytical errors, what we call, impact the patient, the clinician, the healthcare system, and the laboratory itself.
Sorry to interrupt you, sir. Before going in depth, we can have a quick introduction about KI. And our director, Dr. B.K. Rana, has also joined. So we can have a few words from Dr. B.K. Rana. Then I'll give a introduction about KI.
Sure, I'll stop here and I'll withdraw my stop screening. Yeah, fine.
Welcome, Dr. B.K. Rana, sir.
Thank you, Manish. Good afternoon, Srinivas sir. Good afternoon, everyone. Welcome, everyone. We have 85 plus people joined from different part of the world. I can say I see cross-border outside India people joining in. So I welcome everyone for this very interesting 20658 webinar, which is standard published last year, talking about how biological samples for medical laboratories should be, collected, stored, and transported appropriately, so the intended results are the expected results are there, not compromising on the integrity of the sample, which is one of the most critical aspect of medical examination. You may have world-class infrastructure, equipment, highly competent technical manpower, but if your samples, which are collected, not properly collected, not properly stored, not properly transported to the site of examination or testing, you will not get the desired results. So everything will go waste. So it is very, very important that we must take care of the sample, or what you call the specimen, appropriately. and these standards focus on that type. So we are really honored and grateful to Dr. Srinivas, who have been driving this standard for last couple of months, and we at QI partner with them, with Kaveri Hospital and his team to take it forward. So thank you once again. I really welcome you once again for this webinar. Thank you. Over to you, Manish.
Thank you so
Thank you
much.
very much, sir.
So we can have a quick introduction about QI. So is my screen visible?
Yes, it is.
Thank you. So welcome all of you. My name is Manish Kumar. I'm a assistant manager at QI. So I'm looking after the training part. So today now we are here for the ISO 20658 webinar. So QI, we have a vision for nurturing the largest global pool of organization and people through quality improvement and accreditation framework. We have values. We are good listeners. We seek continuous feedback from stakeholders to address their concern. We are also competitive. We look for viable options to benefit users of our services. We have adopted clear transparency. We have clearly defined policies which made available in public domain. We are also innovative. We continuously evolve using co-design and co-creations. And we have a mission to conceive and deliver education, training, accreditation, and related programs in partnership with various stakeholders using an approach of co-design and co-creations. Initially, KI accreditation body operation started in August 2017. We are the fastest developing accreditation body in the world. We have developed 14 number of standards in a short span of 5 years. These are the vertical of KI. So, number one vertical is Center for Education and Training, which look after the training programs as per the various standard ISO 509 and other hospital accreditation programs. Then we have a vertical Center for Accreditation of Health and Social Care, which is CHSC, which look after the hospital accreditation program. Then we have Center for International Accreditation, which look after for the testing and medical laboratory. Then we have Center for Accreditation of Veterinary Facilities. So just have an overview of our programs. Center for Accreditation of Health and Social Care. We have a accreditation program for clinic, ambulatory care facility, hospital, home health care, transition inpatient rehabilitation, telehealth, hotel and homestay, dialysis centers, art IVF, emergency department, green healthcare facility, then patient safety WHO, PSFH, primary and advanced stock centers, and vision centers. We are offering accreditation as well the various standard for these facilities. Patient care continuum, pre-hospital, hospital, post-hospital. We are emerging as a specialist accreditation body. Then pre-hospital, we have emergency medical services, medical transport organization, ambulance services. So we are also developing few more standard for medical transport organization for providing emergency medical services, non-emergency services for land, air, water, ambulance. We are also developing accreditation standard for heart attack, AMI excellence accreditation program, hair transplant centers, cell therapy. So these are the number of accreditation under CHSC. So initially in 2018 to 2024, so we have given 1000, sorry, 111 so far accreditation in CHSC. So we are leading in art and IVF. We have maximum number of accreditation in art fertility centers, 53. Then home healthcare dialysis, WHO military tele health emergency department. So for the same total is triple one. So we have a international recognition for the CHSC program. QI became the first accreditation body in India to achieve ISCO accreditation in less than 5 years of operations. QI is the first and only accreditation body in India having two standard accreditation by the ISQA. And QI accreditation is recognized by the Ministry of Health Central Government Health Scheme, which is CHSC, for the empanelment of private hospital, eye centers, dental centers, and imaging centers. We are also institutional member of International Society for Quality in Healthcare, member of ISQA EEA Accreditation Council, board member of International Society for Telemedicine and e-health. Then we have another vertical Center for International Accreditation, which is CIA. We do offer accreditation for medical laboratory as per the ISO 589 for medical laboratory requirement for the quality and competence. Certification of medical laboratory as per the requirement of Central Clinical Established Act. Then we have also do provide accreditation for the calibration lab as per the ISO 17025 for the testing laboratory. For biobank, we also offer accreditation as per the ISO 20387. We are the first time in India who offer accreditation for the biobanking. We also offer accreditation program for the ISO IEC 17043, which is conformity assessment, general requirement for the proficiency testing, accreditation for reference material producer as per the ISO 17034. Then we also offer accreditation program for the inspection bodies as per the ISO IEC 17020. So for under CIA, currently we have 55 accreditation with QIA. For CIA program, we have international recognition. We are QIA CIA is a full member MRA signatory of Asia Pacific Accreditation Corporation (APEC). We are also full member signatory for International Laboratory Accreditation Corporation (ILAC). Our testing lab program is being accepted by Bureau of India's Standard (BIS), Eastern Railway Central Public Work Department, Directorate of General of Quality Assurance, Power Finance Corporation, Coal India Limited, Legal Metrology Department of Consumer Affairs, NHI, Military Engineering Services, Power Grid Corporation of India, Bureau of Energy Efficiency, Rights Limited, Public Work Department, MP Government, Bhil Bhopal, and Directorate of Urban Administrative and Development, MP Bhopal. We have also international testing lab program, which is accepted by United States of Environment Protection Agency, United States Consumer Safety Commission, World Organization of Animal Health. So this is a golden hallmark of accreditation mark for the KIA. We have a presence in India, Nepal, Mongolia, Myanmar, Bangladesh, Maldives, UAE, Bahrain, Qatar, and Ghana. And we are also working with other countries like Gabon, Morocco, Congo, Oman, Kuwait, Uzbekistan, Kazakhstan, Georgia, and Canada. So we are also offering these countries accreditation program. So these are the various partners with QI, Max Healthcare, Nova Hospitality, Apollo, Chandan Hospital, and Wadi Hospital. Thank you. So now I would hand over to Dr. CN Sirikar sir to take further. I request other to please mute yourself in between the session, so there will be no disturbance.
Okay, so thanks to Manish for helping us to understand what's about the role of the QIA and also how it's recognized globally as an accreditation institute. And our heartfelt thanks for Dr. Rana for being us to grace this occasion on the webinar platform itself. So the importance of the laboratories in the healthcare we were with, where we told that about 80 to 85% of the clinical decisions are based upon the information of what the laboratory gives. And one of the most important thing is the quality of the samples. If we have got poor quality of samples, then you will be having a poor results itself or inaccurate results. And this might lead to an impact on the organizational reputation, clinical outcomes of our patients itself. So the pre-analytical errors, which composites about 70 to 80% of the laboratory errors, do impact the patient, the clinician, the laboratory, and the healthcare system itself. Now, we all have to understand, or we would have understood, that there is a testing cycle, which we call it as a turnaround cycle, or you can say brain-to-brain loop, or a life cycle of a test itself. In this circle, we have got what is called as a pre-laboratory phase or a pre-examination phase. You have got even the pre-analytical phase, what we call as a pre-laboratory phase. That's the name we call for it. Then you have got a pre-analytical phase itself. Then you have an analytical phase, and you have got a post-analytical phase and the post-laboratory phase itself. So the ISO 2658 dwells upon these two segments. That is pre-analytical, which is also called as the pre-laboratory phase. The other one is the pre-examination phase itself. Starting from the identification of the patients for whom we have to do the testing, the TRFs, that is the test requisition forms, how it has to be designed and how it has to be presented to the laboratory, the billing information, what has to be coming across, and how we are going to do the good phlebotomy practices, including the transportation of the samples other than the blood, especially that of the fluids from various resources like serous fluids or the CSF fluids or the synovial fluid, histopathological samples, microbiological samples, samples for the NGS, samples for the cytogenetics. All this has been covered in 2658 itself. Now, the errors do happen mostly in the pre-analytical phase, which I had emphasized upon. Now, what as a laboratory director or a laboratory team we have to do in this stage of pre-analytical phase is the one which is being very critical. The ISO 15189-2022 do have 5 ISO which has been interfaced. One of them being the 2658 itself, the other being the laboratory safety 15190, and rest being the risk management, which is applicable to all the examination phase of the laboratory itself. So today we will concentrate on the ISO 2658, how QII can help us, and how we are able to spread our wings to connect to the laboratorians to make sure that this is being decoded, understood, and how you can take up wings to develop the pre-analytics into a different division to make sure that you bring in quality improvement program to the laboratory itself. Now, when you look into the pre-examination phase or the pre-analytical phase, we have a complex process and we have got random errors which are of concern to us. Now, when you look into the segmented part of the pre-examination phase, we have got these steps. One is the order the test, collect the sample, transportation of the sample, reception of the sample accession, preparing of the sample for the testing, and transport of the samples to the respective bench division or the lab section itself. So in this, if you look, you have got further breakdown of the steps here, where you have got receive the test order, complete order forms, patient location, patient identification, good practices for the collection of the sample, disposal of the supplies, the transportation of the sample, how we have to send it, whether it's a pneumatic chute or a robot or a hand carry or a courier. All these are not being decoded completely in ISO 15189. The ISO 15189 clearly says that you have to download the ISO 2658 and you have to implement. Understand that the ISO 2658 is not an accreditation document, but it is a document which is interfaced with the ISO 15189, which is a documentation for making sure we get the accreditation itself. Now, in other parts of the ISO 2658, we have got how to mitigate the risk itself when we receive the sample in the laboratory, how we have to go ahead with that of the centrifuge, the SOPs for the equipments needed for the sample preparation. Next is how we have to send the transportation to the main lab or the reference lab, and how we have to practice the lean process itself has been dealt in 2658. Now, it also dwells upon the personnel itself or the staff. The staff collecting the samples play an important role not only in the specimen procurement but also on the laboratory result itself. They also have a concern to minimize the errors so that the patient safety in an organization increases, bring a change in the society to bring a societal safety as well as the healthcare worker safety itself. Now, the need to focus on the sample collection is very much essential as we have seen in the previous slides and also by our experience where we can rely upon the test results by improving the quality of the sample itself, which enhances the patient safety itself. Now, there is one of the most important document on our Google, and it is with the NHM and the Ministry of Health and Family Welfare, Government of India, where you have got a training module on the sample collection and the pre-analytical best practices itself. So this is one of the document which one can access free of cost, and you can have a look at the contributions done by a lot of people here. I have marked two of them who are working with one of the IVD companies because they are also partner in vetting up this document itself. Now, let us prelude something about why 2658 is very important. As I told you very clearly itself, the 2658 is not an accreditation document, but an interface document ISO with the ISO 15189-2022 itself. Now, when we are talking about this, in the ISO 15189-2022, we have got 8 clauses as per the documents which we have read through. Under this, clause 4 to clause 8 is very important for us. Under this, 7th one is the place where we have interfaced the 2658 itself. So, we have to understand very clearly that the process requirements is the place where we are having the segmentation like this. You have a pre-examination process, post-examination process, non-conforming work, control of the data, and information management, complaints and continuity and emergency preparedness and planning itself. So when we are talking about the process requirements in the clause 15189-2022, the pre-examination process has to be taken care and we have to have with us 2658 document. Better we undergo a training of about 1 day. It may be in your institution. You can call upon QIA for further details of how to conduct physical training in your organization itself. Now, coming to the rest part of the 2658, what does it talk about? It talks about all these in details, starting from the test requisition, patient preparation, what are the patient identification process. In this, it deals with OP collection, IP collection, how we are going to identify a neonate, how we are going to identify a patient who is in coma, and how we are going to make sure that the sample processing has been correctly collected from an identified person. What is the process of collection of the samples? Here they divide into 2 groups. One is the self-collection of the samples and the blood drawn from the vena pancha. They also talk about the arterial blood collection itself. Next, they talk about the preparation of the process for the sample collection itself. What are the ways you can collect the samples? The capillary puncture, the vena puncture, arterial puncture, venous access devices, how we are going to handle the collection of the samples from the venous access devices. What is the difference between the order of the collection with the adult as well as the child? And what is the difference between the collection of the samples from the pediatric puncture of the skin puncture where we usually do from the heel to that of the vena puncture has been told. In addition to this, the most important point which has been raised in 2658 is the safety of the people who are working in the laboratory and as well as the safety of the patient itself. So these are dealt more in 2658 itself. Now, the launch of the training program of the ISO 2658-2023 was at Chennai, and we were honored to have the CEO of the Quality Accreditation Institution, Dr. Rana, and we had a senior-most laboratory professional, Dr. Simi Bhatia from Mumbai, and the group of the team from the laboratory itself from Kaveri Hospitals. We all had about 70 graduates who were done. They were having the entire workshop done physically in the auditorium, where we had divided them into pre-lunch and post-lunch activity itself. This is one of the snippets of the post-lunch activity where the group was divided into smaller groups. Now, coming back in the month of June, we had second workshop at Visa, which is actually a tier 2 city, and the first time in the state of Andhra Pradesh, in combination with the quantum diagnostics headed by Dr. Srinivas Upendra. We trained about 80 technologists for this document of 2658-2023 itself. The program is usually divided into pre-lunch and the post-lunch. In the pre-lunch, we'll be decoding the whole of the classes of about 2658, which is similar to that of what we have in the ISO mother document. We start with class 4, class 5, class 6, class 7, class 8. We all know that class 7 is the major heartthrob of the document, which is the process management itself, which involves more than 8 subclasses to be dealt in detail itself. Now, who should attend these workshops? These workshops are usually physical workshops, which helps us to do even the mannequin, which is brought in, and you will be having the practice on how the venipuncture can be done, venous access device, how to handle with the needle stick injuries if ever it happens, and how to prevent the needle stick injuries. Who can attend? Any laboratory professional can attend. Basically, it's targeted to phlebotomists, home care personnel, lab technologists, but I encourage pathologists, biochemists, microbiologists too to undergo this training, which helps them to understand in-depth analysis of the 2658. Now, in the workshop, post-lunch, you are having interactive exercise. What are the interactive exercises we have formed? First and foremost is non-conformances identification, where you have given a scenario, about 10 to 20 scenarios are projected. The groups have to identify the non-conformances, identify and interface with the class. The second workshop part is about making a checklist for the pre-analytical audit. That is very, very important. The third part is case discussion on a real-time basis to a visit to the physical laboratory. Whichever is the laboratory, you can do a physical audit on the pre-analytics itself. The fourth interactive exercise, which we usually ask them, is presentation of the checklist itself from the audience itself. They have to present the checklist for the pre-analytical audit. The last part is that we are defining the IFCC quality indicators for the pre-analytical part itself. The exercises are based upon the real-time scenarios what we have got from various institutions, and we have programmed in such a way that it can be simplified even to a phlebotomist, and a local lingual person will also be chosen. Say, for example, when we did in Visa, we had one of the faculty who were able to speak fluently in Telugu. When we did in Chennai, we had people who had frequency and fluency in Tamil. So like that, we are combining with the local languages along with the English to make sure that people who are in the phlebotomy zone, home care personnel, will also be able to understand the requirements of this document. So this is how the workshops are identified. 2 renowned faculty members are identified by the QIA and their deputed. It's a 1-day full workshop, decoding of the ISO document. Remember that ISO document 2658 is copyrighted, and we will not be able to share any of the clauses to that of the host itself. The host will not be getting any copy of it, though we will be giving the books. We will withdraw those books or the ISO documents because these are essentially copyrighted and we cannot share the ISO 2658 without the permission of the traceability to that of the ISO. So I already told you about these. The most important thing is that we will be also discussing the minimal requirements for the specimen collection center as per the Clinical Establishment Acts, as well as that of the accreditation body requirements. So these are all how we have made up a workshop to make interactive, to understand what are the nitty-gritties of this 2658 document itself. Now, in addition to this, the question comes why I should attend. I already told you is one of the important point is that how can I bring an interface between the ISO 15189 2022 to that of the ISO 2658? How can I improve the collection facilities by making the checklist and bringing in a quality improvement process itself? A bit of risk management in the pre-analyticals will be dealt with so that you will understand that how you can take forward the risk management strategy in the pre-analyticals itself. Though the ISO 15189-2022 does not elaborate much, the risk management is dealt as a whole in one of the clauses of 4.6 in the ISO 15189-2022 itself. So next is, now, what does this cover? Does it cover only blood? No. The ISO 2658 dwells upon samples other than blood also, like patient collected samples like urine, stools, sputum, semen, how we have to go ahead with that, and how we have to have a pictorials, and how we have to have further instructions for the patient collected samples. Physician collected samples like arterial blood gas analysis, serous cavity fluids, CSF, biopsies, then amniotic biopsies, cytogenetics materials, bone marrow, histopathology, all those also being dealt with. Lab collected samples like swabs are also involved in making sure that the document spells rightly upon how to go about this. Now, the workshop will also deal upon education and training for the phlebotomist, which may be extended for the second day, where we'll be talking about with the mannequins. We are also bringing across the mannequins and also technical application specialists who will be able to understand and make you understand that why it is essential to go ahead with that of the pre-analyticals. Then what are the troubleshoots when you are having in a troublesome cases, especially pediatrics, or it may be a mastectomy case where they have done the axillary lymph node clearance and you have got lymphedema. Then you have got IV fluid which is going on, and how do you collect the samples during that IV fluid getting onto it. That becomes very important in the education and the training. How to prepare an SOP for the pre-analytical zone may not be much difference with the people who had already worked with the ISO 15189, but we are talking across the SOPs for the sample collecting group itself, how simplified you can make it up, how they can be understood in a designated laboratory where they are working, correct identification of the patient, because this is one of the major things for the patient safety itself, and we would like to appreciate that the correct identification of the patient is done by the blood collector itself. Traceability and custodian of the samples will also be taught, like how you have to make sure that the traceability of the samples, maintenance of the temperatures, how to maintain it, how to track the traceability of each of the sample. Next, when it comes to the quality of the samples, how will you assess the quality of the samples for the hemolysis, blood clots, or microclots inside the tube? You have got any issues of leakage in any of the transportation sample, and if there is any leakage, how are you going to make sure that the biosafety is also taken into consideration? How will you go about the incident reporting system, which is again an occurrence management itself, which we have to document? And what are all the immunization staff practices we have to procure, and you have to make sure that the documentation of the status has been done for the laboratory staff who are involved in the phlebotomy. Now, in addition to this, there are some questions on how you make sure the audit goes in a smooth process. We are going to talk about some of the general points in the questionnaire where you have got blood collector, patient ID, sample ID, where we are going to make sure that you make a checklist. The checklist will be made by the participants. After the end of the checklist, we are going to say that what is the traceability or document which you have to look in for the pre-analytical audit itself. Now, these are some of the snippets on which of the good clinical and laboratory practices, like you have a checklist and consideration on this side, and you have got the process aspect where we are starting from the patient preparation, hygiene, venipuncture, tourniquet application, blood collection tubes, knowledge on the blood collection tubes, knowledge on additives which are there in the blood collection tube. Does the blood collection chemistry alters the measurand which are in question will also be dealt across. Handling of the tube collections, how we are going to do inversion, whether inversion is necessary, how best you can do the inversion, and how you are able to make sure that the inversion does not affect the measurand. Next, biomedical safety and the needle disposal, and coming to that of the transport, what are the ITA guidelines and how we have to transport the samples. All this will be dealt in the workshop itself. Next, this is one of the snippets what we have got from one of the accreditation bodies to show about the checklist to make you understand how the checklist for the patient necessity collection centers are being made. So I think if you are able to get a snippet of the 2658, you should be able to bring in 2658 to your laboratories. QIA will partner with you to make sure that a one-day workshop will be arranged in collaboration with the QIA. You will be getting a faculties who are best well-versed in the pre-analyticals and able to deliver the decoding and make sure that the interaction will be a fruitful journey itself. Thank you very much. The forum is open for the discussion.
Thank you, sir. So, if you would like to have some query or question, you may ask. We are open for this.
Delegates, you have got any questions you can ask or you can put it in the chat box, we can address it. Or do you want any online workshops on 2658? We can also work out with the QIA secretary to understand how best we can work out the online workshops for the 2658.
That would be really better, sir. If we have a one-day workshop.
Dr. Sifali, am I right?
Yes.
Okay, so you feel that a one-day workshop on the online would be beneficial?
Yes, sir.
Okay, Manish, you can note down this feedback.
Yes. So even I had dropped your feedback from into the chat box. So do submit that feedback and mention your query also. And we'll issue the certificate for the webinar also. So do mention your correct name and also mention
Thank
your
you.
query.
Thank you.
Yeah. I think one question is there, like, can you please tell me about the discarding of the sharps? The discarding of the sharps of the needle sharp should be done according to the needle cutter, as well as it should go into the freshly prepared hypochlorite solution if you have got, or you have to follow your pollution control board norms where they require to put you in the what you call the white colored disposable container where it should not have the overcrowding of this white discarder itself. That's very, very important. So make sure that you have a proper needle cutter and you have got a proper discarded into a foolproof container which does not have over spillage because of the overcrowding of the needles there. Okay then, so Manish, you can have your final note.
Yes. So thank you very much, sir, for the briefing about the standard. We have one more question from Mohan Krishnan. as most of the personnel handling the pre-analytical process are more comfortable with the native language.
What's the question?
Just
It's only suggestion, sir.
okay, you are suggesting. Okay.
Because most of the pre-analytical people who is handling, they're comfortable only with the native language, whatever we say in English or whatever the other languages.
Yeah, that's why we told that the QA will attempt to bring in a faculty who will be able to converse in the local language. Okay, then I think Manish, are you going to take a picture of all of us with the video mode?
Yeah. So I request everyone to please switch on your camera, then we can have group photographs. So everyone is ready. Please smile. Thank you everyone for your time and your patience. So thank you, Dr. Srinivasan, for a wonderful brief about the standard. So we will surely implement a one-day session workshop. Either it can be online or offline. We will surely inform you for the same.
Thank you, sir. Thank you. Thank you, everyone. Have a great day.
Thank you.
Thank you.